Often you would find that a number of patients cannot be cured of their cancers. However, when we give the therapies to help with some things like pain, bleeding, and discomfort. So therefore, it's not always about the tumor, it's about the person in front of us. My name is Dr. Kern Pemberton. I'm a radiation/clinical oncologist.
And where are you from?
The Kingston and St. Andrew region, and I was born in Trinidad and Tobago.
When did you move to Jamaica?
I moved here for university at age 18.
Why did you choose Jamaica?
I chose Jamaica actually because of my mom. So my mom was quite familiar with the medical field and knew that Jamaica is the mecca of medicine in the Caribbean. So she was quite adamant that I had to come here to practice medicine to be an awesome doctor.
And where did you study?
At the University of the West Indies.
And what was studying oncology like? What was that journey like for you?
So I actually did not study oncology itself at the University of the West Indies. That's where I did my basic medical degree. And that was an experience. I found it to be quite practical, quite hands-on. So therefore, it really sort of prepared me for the future in terms of my practice. The theory was there as well, and of course, we addressed the limitations, we addressed what we had in terms of resources, but it was very holistic and sort of gave a broad overview of what you should expect for any industry or any area that you should find yourself within in the future.
And why oncology? Where did you study oncology?
So I studied oncology at the University of Cape Town in the Western Cape, South Africa. So I did radiation and clinical oncology there. I chose there because it was quite cost effective, but quite sort of applicable to what we practice in Jamaica. We see similar cancers, we have similar races, so therefore the sort of transferability of practices from there to here would have been so much easier. In addition to such, I like new experiences, so I decided to step out of my comfort zone and try somewhere brand new, somewhere not explored before, just to have that experience and to have that different perspective to bring back to Jamaica.
Why did you choose to study oncology?
I chose to study oncology for two reasons. Number one, radiation oncology is a field that is not quite understood amongst all physicians. In addition to such, what that simply means is that there's a new sort of technology, a new era, a new environment. So therefore, it's a lot of engineering in terms of learning how to use a machine to treat cancers. So therefore, it gives us sort of sleek, sort of physics-based, in addition to that sort of engineer practical vibe. In addition to such, I really wanted to connect with people on a different level. I've had a family history, a significant family history of cancer. However, I really wanted to understand the backgrounds of persons who are diagnosed with cancer, and I really wanted to have that connection or being that person that can tell someone that it's going to be okay. Because sometimes I remember when I wanted to be the person who was told that it was going to be okay.
Could you talk to me a little bit more about the family history?
Sure. So I've had a family history of colon cancer. My father passed of colon cancer at age 59. Quite challenging time for me. He actually passed when I was in medical school. And I remember my family members telling me that I should do oncology because, you know, my father had passed and it would be only sort of fitting. So it sounds a bit cliche and stereotyped to say that, but it was multifaceted for me in terms of why I chose it. However, it really sort of steered me in that direction because I wanted to understand more about what happened, and I wanted to understand more about how I could contribute to cancer development and cancer treatment in the future.
How old are you when your father died?
21 years old.
Why did you come back to Jamaica? You could have worked anywhere else in the world, but why did you come back here?
So I had an obligation to return to Jamaica, but in addition to such, Jamaica has very few radiation oncologists, so it is a sort of developing field, a field that is in need because radiation is becoming or has instilled itself as one of the pillars of treatment in cancers. So therefore, knowing that the area is underserved, knowing that the technology needs to be developed, I thought it was my due obligation to come back and make sure that I'm part of the development process.
In simple terms, what exactly does a radiology oncologist do?
So the term is really radiation oncologist. So basically, we are doctors who treat cancers with X-rays or using some type of radioactive material. So basically, what happens is in the body we have cancers, and cancers are just basically tumors or overgrowths, and these cancers could be anywhere. Yes, you can do an operation to remove it. And yes, you can do chemotherapy, which is what we call the drip that goes through the entire body. But radiation is a bit something a bit peculiar and different. What it does is it uses these X-rays or rays that go to the cancer cells and cause the cancer cells to become damaged. What it actually damages is something called the DNA, so that's like the brain of the cancer cell. And when we do that, the cancer cell is unable to make any more cancer cells, and therefore we get rid of the cancer based on such. However, colloquially, what I tell patients is that it causes the cancer cells to sort of break up, so therefore the cancer cells will die off eventually and the tumor disappears. Sometimes we give it to areas where cancers were, just in case there are any tumor cells remaining that we can't see with the naked eye to get rid of such. So it is something that is important in many cancer treatments. It is, of course, according to the type of cancer or where the cancer is, but we do find ourselves being one of the main pillars of treatments in cancer therapy.
What is it like treating cancer patients? Because you're there for their highs and lows.
So the thing about it is I don't see myself as treating the cancer. That's just basically what made the person present to me. I often tell patients that when we do treat the person when we treat the cancer, the person, sorry, we're treating someone in front of us. So basically, my main job is to make sure that the person's quality of life is maintained. Not so much trying to cure the cancer, not so much trying to make sure that the person has no recurrence of the cancer. What we're really trying to do is say that this person has some symptom or had some symptoms that caused them to present to us. And now that has caused the quality of life to change. And now that the person is in front of me, the treatment is how do I get this person back to a certain quality of life. So often you would find that a number of patients cannot be cured of their cancers. However, when we give the therapies to help with some things like pain, bleeding, and discomfort. So therefore, it's not always about the tumor, it's about the person in front of us. And that's what I really like about it, because it really gives me an opportunity to relate to patients. It gives me an opportunity to see someone come with a frown that turns into a smile. And then in addition to that, what a lot of persons don't know is that it's also therapy for the doctors, because they're different life experiences. You get to see persons from different socioeconomic backgrounds. You get to understand different challenges that persons may face, and it's not just the face value. There's someone behind, there's a story behind, and there's so many life lessons that can be learned from these patients.
What is one of the most powerful life lessons that you've learned from one of your patients?
That I am not God, and I cannot predict what is going to happen. So I had a patient once who had what we term terminal cancer. So we thought that, within due course, the cancer would cause the demise of the patient. However, we were treating her with radiation for pain and discomfort. And it was so funny, she had a daughter who would come with her to every visit. And this daughter had no medical illnesses that we knew of. And she had another daughter. And one evening I got a phone call from that other daughter saying, "Doc, you wouldn't believe what happened." And I said, in my mind, I questioned what could have happened. Maybe the lady with the terminal cancer may have passed, unfortunately. And it was that the daughter who came with the patient every single day was the person who suddenly passed. So I often tell patients, even though you've been diagnosed with this sort of illness and someone tells you you have a terminal illness, you cannot play God. You cannot predict what is going to happen. So therefore, every day we need to live our lives as if it's the last. We need to actually ensure that we treat persons with respect, and we need to sort of appreciate that there's something out there, there's someone out there who determines what the final answer is. And therefore, if you think of it that way, even if you've been diagnosed with a terminal illness, you learn to enjoy every last moment.
What's the most difficult part of being a radiation oncologist? What are some of the challenges that you experience?
So the challenges that we experience are the large numbers. We have increased screening and increased early detection. So a number of persons are coming forth with diagnoses of early cancers, and some of these cancers do require radiotherapy regardless. So therefore, we are quite segmented in terms of what we have to do in terms of our responsibilities. So we have administrative responsibilities, we still have to see patients, we still have to do the planning for the radiation, and we still have our personal lives. So getting that balance or having that delicate balance is important but difficult to maintain.
What's the best part?
The best part? Interacting with the patients and the life lessons you can learn.
How long have you been an oncologist?
I have been an oncologist for 5 years.
And where do you work?
Oh, sorry, that's 4.5 years, sorry.
Where do you work?
So I practice in the public sector at the St. Joseph's Hospital National Cancer Treatment Center and the Kingston Public Hospital, and privately I'm at the Prime Medical Center in Halfway Tree.
How long did you study to become a radiation oncologist?
4 years.
After University of West Indies? And how old are you now?
I am now 33 years old.
Do you have a family?
As in wife and children?
Yes.
You can get that on camera because that's fine. No, I do not have a wife and children, so.
Do you find it difficult because your job is demanding to have a work-life balance?
It is extremely difficult. So therefore, it is important to compartmentalize and have boundaries in terms of what you do with your time. But I mean, if you define yourself as a selfless person, that's a very difficult task. But you know, if you get gratitude from what you do, that also helps with that sort of fulfillment.
Have you ever had a case where the outcome was very much unexpected?
Yes, we have those cases.
Talk to me about the most memorable one.
So the funny thing is, not expected as in good. So this was a patient with what we call a glioblastoma multiforme. So that's a terminal brain cancer. And he was quite young, and we treated him right here at St. Joseph's Hospital National Cancer Treatment Center. And so it is expected that the life expectancy of these patients is less than a year. And he is still alive up to today, so he has beaten the odds. And that was a very, very fulfilling experience and unexpected. So he also was a very, very diligent patient and assiduous in his treatment plans. So the thing about it is we were not expecting it, but we were quite grateful.
How old was that patient?
He was, I believe, I can check. Oh, he was my age. Oh, nice, I can say that.
So he was 33.
He was 33. We were the same age.
This month is Breast Cancer Awareness Month, and you treat a lot of patients with that particular disease. Talk to me about the importance of women getting their mammograms done and also doing self-exams.
Yeah, right. So in Jamaica, we encourage women to start screening from the age of 40. However, what we do see is that there are a number or a cohort of persons who do present earlier than such. So that is where the importance of self-examinations come in for both women and men. So in terms of feeling for any lumps or bumps or any bodily changes. In addition to such, we do see that women of African descent, which makes up by and large the greatest portion of our population, they do fare a worse prognosis than women of other descents. So therefore, we do encourage African women to be very diligent in terms of their self-examinations and ensuring that they do their timely mammograms. The thing about it is breast cancer is a disease, if caught early, can be cured. So therefore, we ask for detection or early detection via screening mammograms. Some women need to discuss with their general practitioners where they fall in the risk assessment. For example, a woman who has been diagnosed with breast cancer at a very young age, less than the age of 50, should be discussing with family members about doing genetic screening, because these family members may be at risk just due to their family history or genetics for breast cancers. In addition to such, breast cancers can also be associated with genetic syndromes to include prostate cancers, pancreatic cancers, and ovarian cancers. So therefore, it is important to have discussions with your general practitioner and to to also have that discussion with your family members to see where you fall in the screening need assessment, in the screening needs assessment.
You mentioned men. Have you seen an increase in the number of men being diagnosed with breast cancer?
So I have not quite seen an increase. So the ratio is 99-1. However, we do incidentally see from time to time men with the diagnosis of breast cancer.
So the misconception that only women can get breast cancer
needs to be debunked.
What's your advice to anyone interested in this field?
I would say that they should do their due diligence and research the field. However, when you do medicine, you have to understand that there are many challenges and you have to have a good purpose as to why you're doing it in terms of helping people and trying to do the best for Jamaica as a country when it comes to cancer fighting services. And in addition to that, I always tell persons the real gratitude comes from hearing the word thanks from someone rather than remuneration.